I think there's two main areas. One would be the clinical indications themselves. I mean, I think some sort of standardization of who is sick and how sick is sick enough to be inpatient versus observation care. I think that type of neutral third party information is a lot of use to physician advisors when they then are trying to spread the word within their own institutions. When they want to talk to their docs about COPD or asthma or something, to have a objective third party, well, here are some criteria to use, I think is very beneficial. The probably less well known, and I think equally important part would be the benchmarks that we have. We have lots of data split out by commercial payer, Medicare payer, by guidelines, so by diagnosis or procedure, around things beyond length of stay, which people probably do know about. We have things like admission rate, the percent of patients who present in the ED who go to OBS, and then after OBS, are they admitted or are they not admitted? How many overall are admitted? I think that's a hard to find number. There isn't a lot of other sources of that type of data out there. There's lots of information on what makes heart failure patients sick enough to be admitted, but what percentage of those patients it is not bandied about very much. So I think those types of benchmarks, and the benchmarks are split out by geography, but even if you take a national average, to go to your staff and say, well, Medicare COPD patients, the admit rate nationally is about 40%. And if your institution or some of the doctors in your institution are admitting 80%, well, that benchmark will be very useful in convincing them that the criteria might be a new way of resetting their severity of illness rheostat. A lot of docs are admitting the same severity of illness that was admitted 20 years ago, and patients are much sicker in the hospital than they used to be. Things that used to be admitted aren't admitted anymore. So using the benchmarks now criteria can help sort of reset their internal rheostat about how sick do you have to be in a hospital.